Type 4 hypersensitivity. A 35-year-old man presents to his primary care physician with a red, pruritic, and vesicular rash on his hands and forearms. He recently went hiking and recalls touching some plants along the trail. The rash developed 48 hours after exposure. Physical examination reveals erythematous plaques with vesicles and oozing lesions on his forearms. Which of the following best describes the underlying mechanism of this patient's condition? A. Immune complex deposition and complement activation. B. IgE cross-linking on mast cells leading to histamine release. C. Direct cytotoxicity by CD8 plus T cells. D. Antibody-dependent cellular cytotoxicity. E. Complement-mediated opsonization of target cells. Explanation. This patient has allergic contact dermatitis, a classic type 4 hypersensitivity reaction triggered by exposure to poison ivy. Pathophysiology of type 4 hypersensitivity. Delayed T-cell-mediated hypersensitivity reaction occurring 24 to 72 hours after antigen exposure. No antibodies involved, unlike types 1, 2, and 3. CD4 plus T cells, Th1, release cytokines, macrophage activation, inflammation. CD8 plus cytotoxic T cells may also directly destroy affected cells. Examples of type 4 hypersensitivity: allergic contact dermatitis, e.g. poison ivy, nickel allergy, latex allergy, tuberculin, PP skin test, memory T-cell response to Mycobacterium tuberculosis, graft versus host disease, GVHD, donor T-cells attack host tissues, chronic transplant rejection, T-cell mediated attack on graft tissue, management of contact dermatitis, topical corticosteroids to reduce inflammation, antihistamines for symptomatic relief, though histamine is not the primary mediator, avoidance of triggers, e.g. poison ivy, nickel. Correct answer C, direct cytotoxicity by CD8 T cells.